Good evening. My name is Nakia Heckel, and today I'm going to talk to you about a medical diagnosis called atrial fibrillation and possible side effects of that being a stroke with those individuals not on an anticoagulant or a blood thinner. After we discuss this topic, I hope that you will gain an interest in atrial fibrillation and learn the signs and symptoms of stroke. This information may help you or a loved one prevent a stroke from happening and may even save lives. As a bedside nurse on a very busy cardiac unit, I have witnessed life-changing and devastating strokes occur in my presence due to patients not being on an anticoagulant medication or blood thinner and then developing atrial fibrillation. So in this speech, I will cover two main points. The first main point is atrial fibrillation and its definition and mechanism of action, and my main second point is signs and symptoms of atrial fibrillation and what you can do to potentially prevent a life-changing stroke from happening. My first main topic in this speech is atrial fibrillation, or AFib. What is AFib? Inside the heart, there are 4 chambers that make up the heart, 2 pumping chambers on the top and 2 pumping chambers on the bottom of the heart that pump blood throughout the body. AFib occurs when one or both of the top chambers of the heart, the atria, do not beat the way that they should, or they beat irregularly. According to the president of Harvard and fellows of Harvard, instead of producing a normal functional beat, the heart produces an ineffectual quiver of the atria, or the top of the heart. When the atria quiver, it can cause blood to pool or stand still in the left atrium, where a blood clot can form and be pushed out through the rest of the body with the next beat of the heart. The blood clot can then travel to any part of the body, but if it reaches the brain, it can cause an ischemic stroke, which can reduce blood flow, depriving the brain of oxygen, causing devastating physical effects. This comes from Boehringer Ingelheim Pharmaceuticals Incorporated. As you can see on my visual aid provided by Julia Berrien, this is the top chamber of the heart where the blood clot can form if the patients are not on anticoagulant therapy. The blood clot then is pushed out through the heart with the heartbeat of the body. Then the blood clot can reach any part of the heart or the body and then travel to the brain, causing an ischemic stroke in the brain. According to Boehringer Ingelheim Pharmaceuticals, the most important way to reduce the risk of developing strokes from occurring with those patients with AFib is to reduce the chance of the blood clots forming by taking anticoagulants prescribed by your doctor. Anticoagulants or blood thinners thin the blood, preventing blood clots from forming and thereby preventing them from reaching the brain with an irregular heartbeat, preventing strokes from occurring. According to Harvard's president and fellows of Harvard, some examples of oral anticoagulants prescribed could include Coumadin, Pradaxa, Eliquis, and Xarelto. Now let's move on to point number 2, AFib signs and symptoms. According to Harvard's president and fellows of Harvard, AFib is unpredictable, it can come and go, or even remain indefinitely. Boehringer Ingelheim Pharmaceuticals states that it is the most common type of irregular heartbeat, affecting 2 million people in the U.S. And according to author Bostock Cox, people with AFib are 5 times more likely to suffer a stroke, and 70% of patients with known AFib who have had a stroke caused by blood clots were not receiving anticoagulant therapy. It is very possible to even have AFib without having any symptoms. Your doctor could potentially discover that you have AFib during a routine exam. Possible side effects can include heart palpitations, racing heart, irregular heartbeat, weakness, fatigue, reduced ability to exercise, lightheadedness, dizziness, confusion, shortness of breath, and chest pain. And all of this is according to Boehringer Ingelheim Pharmaceuticals. According to Floyd and Hayes, more serious symptoms could include shortness of breath at rest, syncope or passing out, and even suffering from a stroke. If you or anyone you know experience any of these symptoms, you should make an appointment with your doctor or go to the nearest nearest ER to rule out AFib. By doing this, you could potentially prevent a major stroke from occurring and even death from a stroke. To summarize, I talked about the aspects of AFib and what happens inside of the heart with those individuals with AFib. The heart beats irregularly, setting you up for blood clots moving throughout the bloodstream, which can travel to the brain, causing a stroke. The best preventative medication to keep this from happening are anticoagulant medications, or blood thinners. I then talked about possible symptoms of AFib and reporting them to your doctor for further workup. Individuals can lead very healthy, normal lives with having AFib if they're on the proper medication, preferably anticoagulants, but can also experience the devastating effects of not being on prescribed blood thinners, such as stroke and even death. If you or anyone you know experiences any symptoms of AFib that we have already gone over, please take the time to notify your doctor so that the appropriate diagnosis can be identified and necessary treatment can be put into motion. Your health matters. Thank you very much.